do the live. So we're live. So hello everyone, this is Fernando with Zen's Tea House, and I am with Ted Knoll, who is a holistic community health leader. And he was one of the founders of a community called First Day. Thank you, Ted, for joining me today.
Oh, welcome. Thank you for asking.
Ted, can you please share with us and the viewers a little bit about First Day and why it is holistic communal health?
First of all, I had worked downtown in Skid Row. I had worked with social model recovery systems down there, and then we had 12 hotels for the homeless. Part of the thing is that small communities have abdicated their responsibility to their local citizens, and what they did is send them downtown, and because they had the resources. And then you see the result of going downtown. So one of the things I came up with when I was a graduate of Antioch University, I'm a master's in organizational management, and I came across a piece of philosophy, which I found out later was a philosophy, but anyway, that I incorporated into my own personal philosophy, and then it developed opening up First Day, and then I'll explain how we implemented it, and it was called RICE, the Reciprocal Individual and Community Engagement, as opposed to what I call DICE, which I think most people do for the homeless. DICE means it's indirect. You just give somebody a check, you give them some food, you give them some clothing. It's just direct to the person, and that's been done for years. And it's reciprocal is the R, the I is the individual, and the C is the community. Now in DICE, it's really the individual, especially the homeless person, versus the community, which is an adversarial relationship. And if you look at that in most communities or what's on the news, people are being moved. I mean, they're really in an adversarial position. And the question was, how do you change that from the individual versus the community to the individual and the community? The last, the E, is engagement. And most people in DICE is they are disengaged. You know, they're not actually connecting to another human being. I saw this person on the street, and here they were in isolation, and I went, how do we get that person back into the community, mainstream community?
So let me just get this clear so that our people, our viewers on YouTube, maybe you're listening to this on a podcast. Ted, you were walking down the street and you noticed someone who was homeless.
Right.
And you asked the question, how can we engage this person? This person is obviously isolated. It's not healthy for this individual to be on the street, but neither is it for the community. So you asked engagement. Now, right off the bat, I'm involved with some local churches, and we have beautiful people in there, little old ladies who love to be out there. But when it comes to seeing a person on the street, it's scary to be engaging. You know, it's intimidating.
Very much. Yeah, the intimacy with another human being is very threatening. It operates out of the lower part of the brain, our reptilian part, which is our survival centers. And what happens is it triggers an irrational fear.
Irrational fear.
Irrational fear. It doesn't make any sense. If you thought of it cognitively and said to prove it, it wouldn't work out. But it's just there. It's visceral. It's automatic. And it's people feel fear, and they feel for their safety. And
which is to some level healthy. I mean, we have that sense of fear. You know, you said the reptile way.
There's what's called the tripartite brain theory.
Tripartite brain theory.
Yeah, and that was from the 1950s. You have your cognitive, your intellectual part, and then you have your emotional and the limbic system in the middle of the brain. But 80% of your body and of you is run by the unconscious part, and those are the survival centers. And in those survival centers, that's where most of our social issues come from, because somehow the person's been hurt or they're in fear, and it doesn't make any sense a lot of the times why we do things that we do, but it drives us.